And apparently in Europe, you can't name your child Nutella. Not sure
Oh,
why.
really? Like
Nutella's
the
tasty.
food Nutella?
Yeah, it's even
Huh.
spelled the same in Ohio, where I am. You can't name your baby Santa Claus.
This is On Call.
Well, this would be really cool to just wear scrubs all the time. Then you don't have to think about what you're going to wear to work.
Joke is awesome. We're here to answer your questions. We can sit down and discuss them. Wait, I gotta go. I'm on call.
Wait, you're on call? I thought I was on call.
Welcome back, everyone, to another episode of On Call with April and Alicia. I'm April.
I'm April. Just kidding. I'm
No.
Alicia. I'm April, April, and
I was
April.
actually not expecting you to say it today because I said I'm April today. I went first.
I've been thinking about it all like this whole time prior to us recording. Like, I'm April and I'm April. And this is April's podcast. It's all about April. Welcome back, everybody, to April
I don't know
Show.
why I really expected you to say that last time, but anyways.
Yeah, well, I did it for you this time. This time I won't let you down. Welcome
There
back.
we go. Yeah, welcome back. How's it going?
It's going. It's Friday. So looking
Thank
forward to the
God.
weekend. I know. We were just talking. We sound like old ladies in their corns conversations right before we were starting. It's like my neck and my finger and I had this and this blah 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 and like this ailment and I'm not sleeping and I'm not feeling good. Like we are falling apart, April.
We really
We're
are.
just falling
I-
apart.
Yeah. Yep.
Like
You know,
that
every
part of
day
age
we're
where you just
we're a
like
day
bend
older,
over.
right?
That's right. The older my mom would say, "This is the youngest you'll ever be." I'm like,
Yeah.
Um,
That's funny.
it's like I really realize like the delicacy of age now, where people are. I'm like, how'd you throw your back out just sneezing? And I'm like, oh, I get it now. I mean, I've not thrown my back out sneezing, but I did kind of throw my back out last week. I don't even know what I did. I just kind of woke up and was like, well, something slipped, but I don't know what. Just while I'm sleeping.
Yep.
So you get injured when you get older, just in sleep, apparently.
Yeah. I mean, the things that I used to do and not hurt the next day that now I'm like, oh my God.
Man, I could sleep on a hardwood floor. I could sleep on a yoga mat. And now I'm like, how many layers? How firm is the mattress? How cool are the sheets?
Yeah.
How much
kind of a
ventilation? Is there an
pillowcase is it?
oscillating
Yeah.
fan? Is there noise? Do you have a sound machine? Like I'm such a bougie
I'm
sleeper.
very high maintenance.
Do you have
over the
darkening
years.
shades? What times is the sunrise?
Yeah. Well, I did a new yoga routine last week. I do yoga, but it's like resistant band. It's kind of a mix between yoga and like HIIT workouts with the resistant band. And just doing that for 15 minutes in the morning, I managed to screw up my entire left arm. So I don't know what I did.
Oh, well,
So
it's the consequences of getting older. You
it
get
really is.
to get injured as you get older.
Yeah.
That's
It's
how you
not
take
fun.
it in gratitude. You get
But I
to
guess
get older.
it's better than the alternative. So we'll take it. So
I guess you could just not be here, right?
That's right.
morbid. So
yep. Anyways, on that note,
I was gonna say what's going. So, and in other news, what's going on in your world?
I got to do something fun this week for work actually. So at Sound we do have interns that are working in our various departments like marketing, legal, compliance,
Okay.
people support.
I don't think I knew that.
I know. I actually didn't know that until I think like kind of springtime. The team that runs the program reached out and said, "Hey, we're looking for some leaders to do some presentations with the interns this summer." And I said, "Well, I'll do it." So I got to talk with them this week about just how they can stand out to potential employers or current employers and managers. And we had a really fun, like, interactive conversation. And it's just fun to me to talk to people who are kind of young in their career. They were in college doing like a summer internship and just to hear their perspectives. And it was really fun. I really enjoyed
That's
it.
awesome.
So, yeah.
And the feedback was pretty good.
It was. One of them actually reached out to me afterwards and said, "Hey, do you have any resources you recommend I use? I really enjoyed your talk." And I had told them during the talk, like, if if there's ever anything I can do, I'm happy to be a mentor or whatever. And they had reached out and said, could we meet one-on-one? So I thought that was really cool.
That's awesome. And then they take that
Yeah.
skill, I guess, back to wherever they're.
Yeah, and I
work.
think some of them said, because I in true profession, I really kind of wanted it to be interactive. So I don't really like talking at people, but so I had them all go around and kind of talk about their internship and what their goals were. And some of them said that they would love to work for Sound one day and that they're hoping that this will be a stepping stone for them. So
That's
it's
really
cool to hear. Yeah.
I love that for you.
It was fun.
It's a really positive, inspirational story.
I
I have
know.
a really positive and inspirational story too.
Somehow I think that's
Um,
not true.
yeah, I think you know my transition. It is positively hilarious. Um, Matt, I don't know. Our kids are funny, and I feel like I always tell stories about my kids. And one day I'm like, they'll look at this as a collection of stuff that I probably forgot over time that was said. But I've been writing things down. I think I told
It's
you
like
just
your
like
own journal, the
it
podcast.
is. The podcast is becoming my audio journal. But we're Maddox and I are getting ready for bed last night, and he's just, I think I've mentioned before, like very inquisitive. And again, we were talking on our last week's episode about challenging your kids to, how do you challenge your kids when they ask you questions you don't know the answer to? And that is the kid that's always going to ask me something I don't know the answer to. Um, but out of the blue, I think he just said, "But can you name your baby King?" And it was so random, and I was like, "I'm sure you can name your baby whatever you want." And he goes, "No, you can't." And I was like, "So you asked me the question because you already knew the answer?" And he
He's
goes,
testing you.
"Right, yeah." And he goes, "But I get in the weeds. I become a 10-year-old with him where I'm like, I'm naming my baby King just right now, just because somebody told me I can't name my baby King." Like immediately, I'm like,
But I
"Who
think you
in the
can't
world's?"
because you can't use royalty names, right?
Well, of course, now you know that. I had no idea. So he's like, two things that are funny about this story. That came out of the blue. We were actually watching the Summer League of Basketball. So I was, unless he was thinking LeBron, except LeBron wasn't playing, I don't know. But he's like, the way he talks to Siri is the first thing I want to just highlight. It's the funniest thing. He he gets Siri on, and I feel like she's gonna move now that I've said that. Um, he says, "Hey, Siri." He'll go, "What are the names in the United States of America in 2025 that are banned in the country?" Like there are so many descriptors in a sentence where I'm like, "Hey, what names are illegal?" Like that's how, and he's like, or if he's asking, like looking up team stats, he'll go, "What are the stats for Damian Lillard in the 2024 and 2025 season for the National Basketball Association?" And I'm like, "Oh my
He
God,
wants a very
Siri went back
specific
to sleep."
answer.
It's just the funniest thing to hear. He's so articulate when he does it, but I'm like, I don't think Siri's checking your grammar. But we did find a list. And I
Yeah.
pulled this list up and I was giggling through the night. Most of these I can't even read on the air. Um, but these are all this. There is a list, and if you want to look, there's actually a Parents Magazine list, but it goes like country to country and what names are banned in certain country. But there's one on here that's just the at symbol. Um, somebody
Interesting.
tried to name their baby an emoji. Basically, it was just the at or just a character. It was just the at symbol. There's one that's like where's that? This is hilarious. This is in Sweden. BRFXXCCXXMNP There's way more characters than that. It's illegal in Sweden, and somebody tried to name their child that and said it was somehow pronounced Albin.
Interesting.
But I was giggling myself to sleep reading some of these. I was like, people are insane. Apparently in Europe, you can't name your child Nutella. Not sure
Oh,
why.
really? Like
Nutella's
the
tasty.
food Nutella?
Yeah, it's even
Huh.
spelled the same in Ohio, where I am. You can't name your baby Santa Claus.
Well, I
Just
mean, you
things that,
can't. Yeah, of course you can't name him Santa Claus.
but why couldn't you? I mean, I don't know. I mean, I wouldn't, but I have run into some people with some very
That's
interesting
true.
names. And probably one that again isn't probably appropriate for the air. I'll tell you, Leader was actually a person I grew up and went to high school with, and the way the parents chose to spell their name made it sound like two different words that
Yeah. You
were
can tell
not
me
great.
that offline. Yeah.
Absolutely. But anyway, well, I was just a little funny. I was one just the how proper we were talking to Siri to look up illegal names in
Yeah.
countries last night. But
That
yeah,
is
so by the way,
interesting.
don't name your baby Nutella.
It is interesting to like think about what makes the kids think about these things. Like, because
Hmm.
mine that's super curious. Like, we'll just be in the car, like talking about something completely, and she'll be like, "What?" And she'll ask this like completely random question, and the rest of us are like, "What?
Where did it come
Where
from?
did you come up with that question?"
Yep.
But we Google and we answer, and we all learn, which is good. See,
And
you learned
sometimes
something
I
last
get
night from
annoyed.
medics.
Well, I did. I actually
Yeah.
did. And what's funny is that I doubled down on the answer. Like, you can name your baby whatever you want. Like, period. And he looked like a
Yeah.
gotcha. Like immediately, it's like, no, you can't.
It's like, I know more
Hold
than you
on.
do,
Let me
Mom.
talk to SIRI. Hey, SIRI, can you? Blah 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 blah
I
blah
kind
blah
of
blah
love
blah.
that he did that too. That's great.
Oh, he gets me
Point
all the
for
time.
medics.
And I've learned now, and I should know my lesson by now. If he's asking me, he knows the answer.
Yeah.
Period.
I think last episode when we ended, we promised a part 2. Is that right?
Yeah. Yeah, the
Yeah.
news that didn't make the news, but kind of made the news, but didn't make our news, maybe. I don't know what we call a segment, but yes, medical news. I'm excited about. I was really chomping at the bit to get to my other story last week, and I know we ran out of time, so I am excited to kind of do part 2 of this. So yeah, let's kick part 2 off
All
and
right.
wrap
You want to
up
go
August in
first?
style.
Yeah.
Do I? Let me think. Do I want to? No, I would like for you to go first.
Oh, all right. Well, so my news story is so it's pretty specific to me as a PA and in the PA profession, but there's been a lot of advocacy around physician assistant practice recently, and one of the things that has come into fruition and now is in place is a compact license for
Okay,
PAs,
yeah.
which we never had before. And so, for those that don't know what a compact license is, it historically, if you had a license, so say I'm licensed in Maryland, right? But if I want to go practice in New York, say, there's usually a list of criteria that you have to meet to get that license. There's not reciprocity, right, between states, so you have to apply for that state license, and there might be other courses you have to take or other criteria that you have to meet to get that state license if you want to practice in another state.
Right.
But the compact license actually allows, if it's a state that participates in that, it allows you to practice in the other states without having to do any other requirements. You essentially just apply, and then you can practice in that state. So it gives you that reciprocity. So it's new. It's very kind of new this year that we have this for PAs. And so we currently have 19 states that are participating in the compact license, which,
Wow.
about a year ago we had none. So
when did this go into effect?
I can't remember exactly when the first state went into effect, but it's been within the past year. So
I know that we were talking about this. I mean, that fits right up my alley with ambassadors, and we our physicians are able to be compacted, and then APP or NPs can get compact for their RN because they've got to get their RN license and their advanced practice license for each state, but at least kind of takes out some of the work if you can be compacted for your RN. But the PA was always an area that we always heard was coming down the pike, but that our team didn't even know that. So that's a major win internally for us. I'm excited to hear that.
Yeah, no, I mean, for sure, for our ambassador lane, it's huge. It's huge
Yeah.
for us to be able to kind of use them in different states and get people traveled around. So
That's exciting to know. I can't wait to take that little golden nugget into my next meeting.
yeah, so
That's
as of July, right now there's 19 states. And so I can send you a list so that you have it
Yeah.
for your meeting.
Is Ohio in there?
Is Ohio in there?
Is your state? I'm just curious.
My state is
still
not
nosy.
right now. Maryland
Okay.
is not, and Ohio is not yet either.
Okay. Well, it's still a move
But
anyway.
it's still a move. It's still a move in the right direction, right? So
Right. Well, I mean, with our physician, I think when I started as director for the ambassadors a couple years ago, I think there were still some like 30, maybe high 30s, low 40 states. We're almost all states now for interstate for physician, interstate compact. So almost all states participate in. I think even New York is making that transition. That was always a big one.
yeah,
For us.
New York is not on the PA one, and I lied to you. Ohio is on the list. Sorry.
Woo woo.
So, yep.
Let's
So
go,
Ohio is on the
Ohio.
list, but New York is not on there yet. So it was officially activated in April of 2024. the
Okay.
compact was. But then, so then people, states have been added since then. So
I wish we would have done better communication around that, or wish we would have known somehow. Huh. Well, I'm
yeah,
like,
well,
I
I see it because I follow the AAPA, all
sure.
their news, and so every time a state gets added, I see that. So
Oh, I love that.
yeah, so
Well, you just
something for
made my
your team to
day.
keep an eye on. Yeah.
Yeah, that was a dose of good news. Or any of our PA providers that are listening right now, figure it out. This is especially if you're traveling or in the locum world or
Yeah.
any of that. That's a great man. It shaves so much time off. You have no idea. Anybody that's gone through licensing, some states, man, whew,
I know.
it's
I
a
mean, there was
really
like
long
another
process.
a time that we, potentially were going to move to New York, so I looked at licensure there, and you had to take like extra classes and stuff. So
Oh
I'm
yeah,
watching out for when Maryland gets added, so because then I can do it. So
that's wonderful. I got my compact recently, but I don't anticipate that I'll be traveling a ton, but I kind of just did it to be available. But that's exciting. I'm stoked going into my next meeting. I'm going to pretend like I found it out all by myself though, so I won't give you credit for it.
all right, I'll
Just
forgive
kidding.
you.
Of course I'll give you credit.
You can steal my thunder if you want. Go ahead.
Okay, well, if we check that interstate compact, watch this transition, and travel down the interstate to Chicago. You like that?
Uh-huh. I like
Look at
it.
that improv.
Uh-huh.
Um, in Chicago in April of 2004, there was a young lady that was born that was really kind of destined to try to change medicine. She Her name is Deja Taylor. I don't know if you've heard about her. She's hit the news. I think I've seen her in a couple different outlets. I've again my Echo, my lovely Echo show that gives me all my headlines. Um, I saw it on that. Lived in Chicago, later moved to Indiana and Iowa, but she really got involved at a very young age in community equity work. She advocated a lot in her youth, just anti-racist education with her school board, trying to keep what we know as American history preserved, I guess, in her mind, preserved in our schools. And in 2019, she was a junior in high school and she was in Iowa. She launched this independent STEM research study that was kind of combining her passion for social justice. So it's kind of along the same lines of Hemin, um, underserved communities, along with science, which was her passion. So her the problem that she was trying to tackle with her STEM project was surgical site infections and how many of those infections, like 11% of surgical sites become infected. And then in middle income countries, there's like up to 20%, I think, of like C-sections. In some African regions, there's like even a higher percentage of that. But in the wealthier nations, like surgical site infections are really only about 2 to 4%. So she was trying to look at like how do we how do we manage infection or how do we identify infection early, especially in these again vulnerable marginalized populations. So she started thinking of this high-tech smart suture um, that could be pretty cost um, appropriate, but also pretty innovative. And she discovered that beet juice in her research acts as a natural pH indicator. So it transitions from this really
Hmm.
bright red at a pH of 5 on the skin into this really deep purple when your pH hits a 9. So after testing, she did like 30 beats, all these various fibers. She found that this cotton polyester blend suture binds with the dye and then visibly changes colors within 5 minutes when exposed to an infection. So what she's currently working on, and she won this Regeneron Science Talent Search, earning. She's like taken all of these sutures into testing now, and obviously there's some pros and cons. But technically the pH-based detection, there's some question of it will do superficial infections. There's some question of like would it identify deeper tissue infections. But as far as affordability and simplicity, it really does kind of act as a conduit for those that maybe have a little bit more challenging access to care. So she's really kind of in the process and she's working through it right now. And all I kept thinking was, how brilliant. Why don't we think of this sooner?
That is interesting.
Like,
So it'll detect it. So the infected tissue would have to touch the suture. So it's like a super kind of like right under the layer of the suture. And is there like a time frame of the beet juice wearing off, or is this just as long as the suture is in, it would detect it?
I don't have that information as far as like the nuances. I know that it is gone to like not to
Like
research.
testing. Yeah.
Thank you. I was going to say
Like the FDA.
it's
Yeah.
we're in study. Yeah, for it. I think she's in phase 1. But what I did but what they did say was that's what I mentioned earlier, like within 5 minutes of coming into contact. So I'm guessing when you've got, cellular change, cellular turnover, cellular damage, invasion of white cell, whatever is, currently happening, that is when those sutures change color and alerts the
Yeah.
person that it's happening. But the other thing that was kind of cool with her pursuing beat, which is pretty easy to attain resource. It's not expensive. It's, you're using pretty much a resource that's in every country. But the
Right.
beet dye reportedly in and of itself does offer some antibacterial activity against E. coli. So there could just, be an additional benefit in antibacterial protection there. So I think right now,
Interesting.
yeah, I think she's working on patenting it, and she really hopes to just deploy it ideally at first. In the interview I watched of hers, she really wants to start in underserved communities, again similar to Hemin, where his focus on our last episode. If you guys
For the
didn't listen to
soap.
that, go back to
Yeah.
that. Yeah, just that the Ethiopian son, and management of early skin cancer. But yeah, I mean, these kids are brilliant to me.
Yeah,
um
that's awesome. I mean,
I would
that's
love to see. I mean, imagine just being, either your generalist at the bedside, or even if you're surgery or whatever, but you're coming to check a patient's wound in-house and you're like, "Oh, it's purple." You
well,
know?
even like a patient at home. Like
Yep.
I think back to like I had, like sutures at one point that in the scar it was like really funny from it. And so I had like seen a different provider for something else and I said, like this scar. And they ended up looking at it and it ended up that I had gotten infected like underneath and there was like a lot of like tissue. So like had I had these sutures, I would have been able to see it because it was like I had a procedure done that was outpatient.
Right.
So I wasn't following up with anybody about it, and I would have seen it myself and said, huh, that's funny.
Yeah.
Maybe I should call the doctor, So
Well, I think about, well, and you're right. And I think if you're talking about, you're going underserved, vulnerable populations, there may be just lack of education in general.
yeah.
So I think for the most part, basic, we know our colors. So, and I
Yeah.
don't mean to dumb it down, but I do think like we learn as clinicians to talk to the patient at a level that they can understand. And sometimes that is like the amount of school that they've completed. Sometimes that's they may have completed enough, but there's challenges in processing. We have to learn how they hear us, right? And I think just to have a color change, it's almost like it goes to a red to green. I kind of wish it was that easy because we all know
Right.
red is a stop and green is a go, but even just a red to a purple, and it's a bright red, beet red to this really, really dark purple. It's just enough that you don't have to be scientific. You don't have to check your temperature. You don't have to, assess your vitals, get blood work, look at a differential on a CP. You don't have to do
Yeah.
any of that as a patient to become an advocate for yourself at that point. And I think you're right. Early detection in the, post-op phase when you're home can, lead to better outcomes. I was also
Yeah.
thinking about
Well,
some of those
also like it
cases.
might say some CT scan, some radiation in the hospital, right? Because we see,
Absolutely. Well, the cost, right?
we'll know, like, because you see it's a little puffy, it's a little red, like, is it infected, is it not? And you end up doing a CAT scan. But if it's purple, it is, right? So,
Mm-hmm. I had a patient, it made me think of this patient I had a long time ago. Um, I would say probably 2009, 2010, somewhere around there. And he had had some pretty significant abdominal surgery. And I had a really great relationship with the surgeon. And not, the residency team was fairly a new team at that time, but I knew this patient. I had him for a while. You get continuity with the patient. When I had him pre-surgery, post-op as well. But he just, like, his wound was draining so much, and he was maybe post-op day 1 or 2, and I just kept like thinking, I'm like, I'm not a surgeon, but some wounds we do expect to drain. Usually we do put some kind of drain in place when you expect to have that much. But it wasn't purulent. It didn't smell. He wasn't having pain. It wasn't red. It just was draining. And I was like, this just doesn't feel right. And it looked like he had dehisced just a tiny bit. A couple of the sutures might have popped open. But I feel like it was about a day that I felt that I was like really starting to push on this team that we're changing that. We're now adding ABD pads. Like, so those that don't know, like think thick maxi pad, like we're changing those pretty frequently. And he was infected, but he had kind of had a loculated mass underneath. So he did end up going back into the OR, but he was the first one I thought of, like, outside of drainage, which was clear.
Yeah.
There wasn't a ton of sign. He felt fine. He was up mobile. We maybe could have intervened a little bit early. Gratefully, he got a good outcome. He healed. He went home. He was, done great since. But it just, even in the inpatient setting, things that can set in pretty quickly. And then we all think E. coli. Anytime you're doing an abdominal surgery, that's one of your biggest risks for wound infection. Just given its location and given the gut.
Yeah.
If it's got some antibacterial property against E. coli, I think it's just a major win. But it takes my brain to, when's Maddox going to invent something? When can Maddox invent something like this and challenge me with that, instead of what names to name people? But in all seriousness, I just think it's so neat.
It is.
And you're right, like the cost of healthcare right now, so great that if we had these simple things in place, we could decrease our amount of exposure, radiation exposure, testing, taking up hospital beds, and being able to manage these things outpatient,
Yeah. I mean, it's, we went into medicine because we're passionate about it, but it is cool. Just like the things that we can advance in over time, so it's fun to see it. So.
Yeah, I love it. So, and I love this segment, and I feel like I want to do more of this, because this is not that I don't feel good after every podcast. We laugh, we joke, we have a good time, we do tackle serious subjects, but it's just nice to see innovation. I don't know, there's something about it revives me, even on a Friday afternoon after a really challenging week of work.
It's kind of refreshing to hear the new things, and
I learned that there's compacts for PAs, which I'm the one that figured it out. So I can't wait to tell everybody.
Of course. When you're in your meeting, just make sure you say, yeah, we have a compact license. Hold on. Let me pull up the list April sent me.
No, I'm going to say, hold on, guys. I talked actually to the APA myself. And so here's what they called me to let me know before everybody knew. I just forgot to tell you guys in 2024.
Yeah, well, it was enacted then, but it took a bit for people to join.
Yeah, we were rolling it out slow. We didn't want to overwhelm the states.
It's really recent. It's like hot off the press.
Yes, I think we should do this. And if anybody out there listening, like, you have some good stories, your kids are doing amazing things, let us know. I would love, especially our children, our youth. I get really excited. Again, I think it just refreshes me, April, to think, our peer group, our age group, even those, scientists and researchers that are older, are great. They've paved the way for us to be where we are, and we've taken amazing leaps and bounds in medicine. It's just so exciting to go, like, there's not going to be a gap, because our youth is doing the same thing. And we're actually, I think, probably a lot more interconnected, just given social media and given our interconnectivity, just even with ChatGPT now and ability to access all these other data banks. I'm just excited about where medicine can go here. But if you are in our listening audience and you've got a child that's involved in things like this, or you've experienced this, or you just have an idea of a really cool story, a news story that you'd love to share with us, and maybe we can highlight on one of these episodes, we'd love to hear from you. You can always find April and I on Instagram. That is our social media page at On Call with April and Alicia. You can also find us on LinkedIn, same tag, at On Call with April and Alicia. For all of you folks who aren't emailing us, I think we say this in every episode, we've not had an email yet. Be the first. Yeah. If you'd like to email us at oncallpodcast@soundphysicians.com. And you can find and subscribe to our podcast anywhere you listen to your podcast. So please do that. Subscribe, leave us a review. That always kind of helps push our podcast up, to get our viewership to other people that may not know that we're around and may need to know that PAs can have an interstate compact, like I just found out today. And I just learned and told April about. So Any ideas that you guys have, obviously we love to interact with you. It's always exciting to, bring this information to you. So thank you guys again for listening to another episode.
Absolutely. And until next time, you guys stay well and we'll stay on call. Bye, everyone.
Have a good week, guys.